specific symptoms. However, if you just have the right trigger, the correct factors in the environment, we're not going to go to the prodromal stage. Some symptoms may appear, and now this individual is going to be highly infectious. In other words, now there's a greater chance of you getting even more sick. Highly infectious. Starts off slow, and then you can become highly infectious and get really sick, which is the next stage, full disease. Full symptoms up here, and now at this peak, you have a great chance of spreading what you've got. This is now you become highly contagious. This also means that you're highly communicable. Highly contagious or highly communicable. You have a greater chance of spreading the love. Then you got your convalescent stage, starts to decrease in severity. Symptoms starts to disappear. Some diseases may go back to being dormant until it is triggered again and can act up. Okay? So you can actually get sick 2 or 3 times with the same germ. Has that ever happened to you where you get better for like 2 or 3 days and all of a sudden it kicks up again? It could be the same virus, or it could be another strain, but it's usually the same virus because it's just remained dormant and gets kicked up again. Okay. HIV or human immunodeficiency virus. This is a virus. It's not a disease. It is the virus that causes a disease. Follow? So the virus is known as the HIV virus, which causes AIDS. The virus may be passed from one person to another. For example, when the infected blood, semen, and vaginal secretions come in contact with an uninfected person's broken skin or broken mucous membrane. And it goes through your bloodstream. And that's how the person gets infected. Remember, that's the virus. People with HIV have what is called the HIV infection. HIV suppresses the immune system, so again, it causes what's known as AIDS. It compromises your immunity to fight other infections. A person with HIV infection may not demonstrate symptoms of AIDS for several years following infection. Right? This is why you're called a carrier. You have it, but because the symptoms do not appear, you unknowingly continue to have that kind of lifestyle, which can now, someone susceptible gets the disease. So a person infected with HIV does not develop AIDS, may unknowingly transmit it to a virus to others. AIDS demonstrates with a series of infections which are opportunistic in nature. So again, reiterating what I said before, you don't die of HIV, you don't die of AIDS, you die by a complication of AIDS through other types of infections. So I want you guys to understand that. Understand the concept. The bloodstream is a chronic carrier of HIV. The most common method of spreading the HIV virus is by direct contact. What does direct contact mean?
Person
to person, or what's the other one? Accidental needle stick. Okay? So all sexually transmitted diseases such as HIV, AIDS, and exit site must come in contact with an entry site. No other means of transmission has been proven. It's bloodborne. All right? And as we know, it also cannot exist out of the host for more than a couple of hours. So outside of the host, it dies immediately. AIDS cannot be cured. We still don't have a cure for it. I highly doubt that. I think there is a cure for it. Believe in government conspiracies?
Oh, yeah.
This is one of them that I highly believe in. You can't tell me that there isn't a cure out there. I'm sure there is a cure. But can you imagine what would happen if there was a cure? Does it put hospitals out of business?
Sure does.
Think about it.
Billions.
Okay? Think about it. Okay? Same thing with cancer. You can't tell me there's no cure for cancer. There's got to be a cure for certain cancers out there. Okay? Especially with the technology that we have. Okay. That's just my opinion, guys. That's just my opinion. All right. AIDS cannot be cured. Treatment is done palliatively, which means that when you hear the term palliatively, we are basically trying to make the patient as comfortable as possible. They're terminal. In other words, they're going to die, right? We're going to try to make them as comfortable, as pain-free as possible, okay? Palliatively also means that we can slow the progression of the disease. It can also mean that we can prevent other infections from occurring, okay? It also means that we're going to suppress the symptoms. So a lot of the pains, a lot of things that they manifest during their times of sickness, we can alleviate that and make them a little bit more comfortable. This means palliatively, okay? We're not treating the disease, we're treating the symptoms, okay? We talked about hepatitis. I'm a little bit more scared about hepatitis because it can exist out of the body a little bit longer. And more of the human population has hepatitis than they do AIDS. Most commonly is hepatitis virus C, HVC. Hepatitis virus C is more prevalent and more common in bloodborne infections in the United States. This can occur through accidental needle sticks, multiple sex partners, IV drug use, and multiple blood transfusions. Now with hepatitis, hepatitis simply just means that it's a liver infection, okay? This may lead also to other liver diseases such as cirrhosis or hardening of the liver, and also liver cancer. So before I proceed, I've got another story. I have a cousin who was in healthcare, okay? Now, if you guys know anything about Filipinos, we're all over the hospitals, okay? Nurses, doctors, whatever. There's a bunch of us in hospitals, okay? That's what we do when it comes to the United States. My cousin, nurse, a few years ago, was caring for someone who was full-blown Hep C, full-blown Hep C. She had given her patient an intradermal injection of some kind of medication in the arm. She placed the syringe and needle down on a Mayo stand like so. And then someone had walked in, distracted her. I don't know what it was about. Maybe a doctor had come in talking about some questions on the chart, or maybe a nurse had come in talking about maybe another patient that they're caring for. But she was distracted. As far as we know, somebody came into the room and her routine was interrupted, okay? So with that said, after the person left the room, she forgot about that needle placement, and when she went to reach for something, she got stuck with the needle. Immediately, she reported it to her supervisor, and they went through the full regimen of getting the injections and also pills to fight the infection, okay? A few months went by, she was fine, okay? And she had normal blood tests to make sure that she didn't have the Hep C virus. Well, 6 or 7 months down the line, she did have it. So all the things that we did, the preventative care, the medications, the injection, it did not get rid of the Hep C. So she had Hep C. It was very aggressive, very lethal. In less than 2 years, she had liver cancer. Less than 2 years, okay? And we lost her. She was 48 years old, okay? Again, I'm not trying to scare you guys. You gotta be able to know what you're getting yourself into if this is the field that you choose to work in. Everything is not all about, daisies, okay, and sweet-smelling roses, okay? It's not about that. Any field that you choose to get into, there is gonna be some sort of work environmental hazards. This is one of them, okay? And what we're trying to do here is equip you with the right amount of knowledge and also the tools to know how to handle your environment and protect yourself from these hazards, okay? So that was one of them. It was sad. Okay. Tuberculosis. Tuberculosis is caused by spore-forming bacteria. There's that term again, spore. Okay, remember bacteria. They have a protective coating, the endospore. So now they have a protective coating. These are very resilient to the environment, and they can thrive for a very long time. It's usually respiratory, okay? So it is an airborne contaminant. It's usually respiratory, and it does affect the lungs. Most common in lungs, but can also affect other areas. There has been an increased incident of tuberculosis, again, because of immigration. They are highly communicable, which means that I'm highly contagious and I can easily transfer that tuberculosis from me to another person, but only when it's active. All of us, again, have some form of tuberculosis, okay? Because it is prevalent in our society, and you've probably been exposed to it and you just don't know, okay? It could be, you could have gotten it by simple communication with somebody who has it. Remember that safe zone that we're talking about? And you're having a conversation, all of a sudden you feel something hit your lip during conversation? That wasn't you, okay? That was probably the person speaking in front of you, and you're doing this, okay? It could be that and I was also told this, that you went and got your fruits and vegetables. You don't know if someone had coughed over those fruits and vegetables, right? We don't see everything, but do you think that happens? Sure it happens, okay? So it may come from the fruit and vegetables that you picked at the produce department. That's why you gotta wash your vegetation, and anything that doesn't come in a package, you need to wash it thoroughly. I'm not just talking about TB, but anything, because remember Typhoid Mary? I could have been the one that was scratching my butt and picked up an orange, didn't like it, and like put it back on a stack of oranges. I could have been that person who likes buffets. Who loves buffets? All you can eat, right? All you can eat. But I'm also apprehensive about eating at buffets, because I've sat there, and I'm very observant. I sat there while I'm eating, and I'm watching people get their food. Okay? I've seen this. Okay. Ooh, let me try that. Okay. I've seen that, and then they're picking up another serving spoon to put their food on there. Okay. I've seen this. I've seen this. Okay. And it's just not that. It could be the door handle. It could be the escalator handle. It could be the button on the elevator. Okay. It could be the phone that you pick up. Are you guys with me?
I'm gonna go live in a bowl.
If you knew exactly what was out there, you would never leave your house. Okay? You would never leave your house. But remember what I said. I used to be one of those. I actually used to be a germaphobe. I was real paranoid about certain things, how I touch, how I clean myself, how I let people in and out of my house. And I said, you know what, I can't live like this. Okay? So TB is highly communicable. Usually there are no apparent signs and symptoms. With the early stages, you may demonstrate fatigue, loss of appetite, weight loss, fever, and night sweats. Does this sound familiar or look familiar to you guys? Because it should. Every time you go into a clinic, when you see a new doctor, or when you go to a clinic for some sort of, I don't know, some checkup examination, don't they give you a clipboard with a set of questions that you need to answer before they admit you? Did you notice that the questions ask, have you noticed any fatigue? Have you noticed any loss of appetite? Have you noticed any weight loss or fever or night sweats? You guys remember that questionnaire? This is what they're trying to rule out to see if you have tuberculosis. It's one of the first set of questions they ask you before any other sets of questions. It's going to be number one. If you haven't done that yet, you'll notice it the next time you go into a hospital or clinic. Okay? Later stages, you may be coughing. Hemoptysis. What's hemoptysis?
That's spitting up blood?
Okay, coughing up blood. Okay, coughing up blood. Wheezing. Rales, tracheal deviations. If you are making a sound while you're breathing, it's probably because you have TB. If you have chest pain, it's possible that you may have TB. Okay? Again, just like anything else, it can remain dormant. Just the right trigger to cause it to activate, and there you go. All right, that's TB. TB in its early stage is treatable. If left untreated, lung tissue is destroyed, leading to respiratory failure. So it actually destroys your lungs if it is untreated. All right. So as soon as you guys, again, this is for warning, just to protect you guys, when you start experiencing this, okay, check yourself into the hospital so you can get the medications right away. It's very treatable. Okay. So don't ignore it. Go to the hospital. We can fix you. Okay. The the antibiotic and antimicrobial types of medications. Remember we talked about constantly taking your antibiotics and you're just taking it every time you get sick? Well, eventually you're also causing those germs to get stronger and stronger and stronger. One of these diseases is called MRSA. It stands for methicillin. Remember, methicillin and vancomycin are the strongest antibiotics that you have on the market. If you are resistant to those medications, the chances of you getting better is very slim. You may get better, but it's also going to take a very long time for you to get better. Okay? Again, all of us at one point or another may have been already exposed to MRSA. You just don't know it. MRSA can be easily acquired as going to the gym, walking around barefooted.
I don't know how people do
How
that.
many of you guys have done that?
Never.
It can be as easy as sharing your sippy cup with your best friend. How many of you guys have done that? It can be as easy as borrowing your friend's baseball glove or their hockey glove. Anything that has collected moisture, okay, and it's just sitting there, remember, where do microorganisms like to thrive?
Dark.
Dark,
Warm.
moist places. Guys, wash your jock straps. Okay? Those are places where they like to harbor. So if you're also exchanging athletic equipment, okay, you're increasing your chances. Okay? That's how you can get MRSA as easy as that. Okay? Yoga mats. The bench that you sit on when you're lifting weights. I hope you guys are wiping them every time you use it. Am I scaring you guys? If I am, then I'm doing my job. Okay, so that's vancomycin. Then you've got carbapenem-resistant enterobacteria. Okay, CRE. Okay, again, it's a different type of resistant type of bacteria. This is another strong type of antibiotic. Bacteremia, fungemia, C. diff. Remember how we said that there's a general amount of bacteria or microorganisms that are produced. However, if there's an excess of it, it can also be lethal and dangerous. This is C. diff. Okay, Clostridium difficile. It's an overproduction of bacteria causing release of toxins. And then we also have ESBL, extended spectrum beta lactamase. You guys just read this, be familiar with it. Okay, but these are antibiotic, antimicrobial types of diseases. All right, any questions so far? What I'm going to go through here now is strictly review because we've already talked about this. Okay, isolation precautions developed by an example OSHA. They tell us how to protect ourselves from these environmental factors. These isolation precautions help control the spread of pathogens that can cause disease. It can prevent the perpetuation of the cycle of the infection. And number 3, it can prevent the spread of disease from patient to staff or from patient to patient. Remember the 2 tiers? Tier 1, Tier 2? Okay, Tier 1, standard precautions. That refers to what?
Ourselves.
Okay, it refers to how we're going to protect ourselves. What is it that we're going to wear? Remember the PPE. What does that stand for? Personal protective equipment. Gloves, masks, gowns, goggles. Okay, your PPEs. What is your standard when entering a patient's room?
Gloves.
Minimum of gloves. And the rest of it is dependent on the type of patient that you deal with. And then we also have the transmission-based or the type of infection that the individual has and how we're going to isolate them from the rest of the population. Okay? So this is your standard precaution, Tier 1. What are you going to wear? Number 2, how are you going to isolate the infected person from the rest of the population? Usually it's category specific. So again, it's based on the type of disease or infection that they have. Is it airborne? Is it droplet? Is it contact? Now, prior to you, if the patient is isolation, there will be a huge yellow sign outside of their door. So that is your warning sign. You're not going to enter the patient's room if there is a yellow sign at the doorway. That doorway, that sign will tell you what type of infection they have. It's also going to tell you what PPE you're going to be utilizing. So you're not going in there blindly. You're going to know what it is, and you're going to know how to protect yourself. Okay? The first one here is airborne isolation. These are examples of airborne isolation. I want you guys to be familiar with these type of diseases. Airborne isolation includes SARS. Have you guys heard of SARS? Sudden acute respiratory system. It is a sudden infection of the lungs. It causes respiratory distress. It can cause you to stop breathing, and you can die immediately. That's SARS. Smallpox, chickenpox. Did you know you can get chickenpox by breathing the air? It's not just contact, it's also breathable. Okay? Rubiola, what's rubiola? Measles, very good. What's anthrax? Okay, anyways. And you know also about tuberculosis, okay? Anthrax is also a lung type of disorder. Know this, and know that it's related to airborne isolation. Now, how are you going to isolate them from the rest of the population? They're going to be in a private room, so they get their own room with negative pressure. Negative pressure room. Now notice that when you guys enter a facility, that when you open the door, don't you get hit with a gust of air? That's positive, so air is coming out. In a negative pressure room, when you open that door, air gets sucked in. Keeping what's any type of contaminated in the room, it's isolated in the room. It's negative pressure, it's sucked in. So nothing escapes, and it's contained in their private room because it's airborne. Okay? So private room, negative pressure, because it is respiratory, we're going to have you put on a TB mask. These are special masks that although they are porous, the knitting of the mask is very, very tight because it's preventing any type of droplets from entering your mask and you breathing in. So the masks are knitted very tight. With that said, if you have a TB mask on, although it's porous, it's hard to breathe. Because it feels like someone's got a cup over your face that's not tight but loose, it's still hard to breathe. Okay? You're going to exercise, the door is closed, and you're going to exercise standard precaution. Again, minimum of what?
Gloves.
Gloves, but what is it also telling you to wear? A mask. Okay? Number 2 is droplet. Okay? Droplet. Droplet-borne contamination when the individual coughs, sneezes, or talks. Remember what your safe zone is. A minimum of 3 feet. This includes, what's influenza?
Flu.
Okay? Mumps, whooping cough, pneumonia. Okay, these are droplet type of isolation, type of infections. So what do you think? In addition to the gloves, what do you think I'm also going to wear?
Mask.
Possibly a mask, right? If you're within 3 feet. As long as you've kept that safe distance, it's not necessary for you to wear that mask. But what are you going to do because you're paranoid?
Wear the mask.
I'm gonna wear a mask, okay, because I'm paranoid, so I'll wear one. Okay? So only wear one if you're within 3 feet. Room may be left open because it's droplet. It's moist. So if anyone coughs, sneezes, or talks, that droplet is going to hit something and be soaked up by the cloth, the linen, or whatever. Okay, it's not going to fly out of the room. Okay? Contact isolation. Remember, direct contact is person to person. So if you're dealing with wounds, there's your scabies. Okay? Hepatitis, virus A, herpes, lice, conjunctivitis, anything that is contaminated, like even contaminated fluids, okay? Where you're going to find MRSA or maybe VRA. Now, MRSA can come in any form. You can have upper respiratory MRSA. You can have wound MRSA. Okay, MRSA is MRSA. They'll tell you exactly how you can get it and how you're going to protect yourself. Okay? Then you have indirect. Person to object to person is indirect. You're talking about contaminated objects, such as the table, linen, the stethoscope. Okay? Remember, dirty needle or contaminated needle is considered direct and not indirect. Now, the way you would isolate them, they can be private or they can be shared with someone who has the same type of infection. Okay? We want to keep them together. Gloves, that's your minimum standard precaution. And then, depending on the type of infection they have, you may also require a gown, maybe a mask. Okay? Any questions here? Last one here is known as expanded or strict isolation. When you see this, expanded or strict, that means you're going to wear everything. Gloves, mask, gown, goggles. It is strict. You are going to wear everything. Everything. Expanded and strict isolation is broken down to two different types of conditions. The first one is where the person's immunity has been greatly compromised. Because their immunity has been greatly compromised, such as if they had a burn or a major organ transplant, their immunity is going to be greatly compromised. So now we are protecting them from who?
Us.
Us. We're protecting them from us because we are also carriers, so we want to make sure that they don't get infected with whatever we're carrying. Their immunity is greatly compromised. Stethoscopes, blood pressure cuffs, and thermometers, they were exclusive to that patient. You know how doctors use their own stethoscope and they're going from patient to patient to patient? These guys are going to have their own, including blood pressure cuffs and thermometer. It stays in the patient's room. It's theirs. If you're visiting somebody who is in strict isolation, do not bring any plants or any type of vegetation. Where do microorganisms like to harbor? Warm, dark, moist places. So avoid any of these things. If you are sick, don't enter the patient's room. If you're a visitor that's sick, you cannot enter the patient's room. Okay? This specifically is also known as reverse isolation because we're not protecting ourselves, we are protecting them. It's reverse. Okay? This term, expanded and strict, just means you're wearing everything. Okay? Specifically, if you're protecting the patient, it's reverse isolation. The other condition too is if the patient has a systemic infection. So now it's not just in one place where they have the infection, it's whole body, it's systemic. Gloves, gown, mask, goggles. Okay? Their entire body is infected, so now you're protecting yourselves by wearing all the appropriate PPE. Everybody got that? How are we doing? Are we done?
You tell me.
You guys tell me. Okay. So, before